Hey there everyone, welcome to my channel, Nurse ME here. I have picked some questions to put your nursing knowledge to the test. If you have any questions, do not hesitate to post them in the comments section and I will respond to you. I passed the NCLEX on the first try and I would love for each one of you to pass as well. Now before we jump into the questions, make sure you hit that subscribe button and give this video a like. And do not forget to drop a comment below sharing how many questions you got right.
What is the first step a nurse should take in the event of a fire in a healthcare facility? A. Extinguish the fire. B. Alert the fire department. C. Rescue patients in immediate danger. D. Close all doors and windows. The correct answer is C. Rescue patients in immediate danger. Rationale. The first step in the race, rescue, alarm, confine, extinguish, protocol is to rescue patients who are in immediate danger. Which safety device should be used for a patient who is at risk of falling from bed? A. Bedside commode. B. Side rails. C. Bed alarm. D. Transfer board. The correct answer is C. Bed alarm. Rationale. A bed alarm alerts staff if a patient at risk of falling tries to get out of bed, providing timely intervention. What is the most effective way to prevent the spread of infections in a healthcare setting? A. Wearing gloves. B. Using hand sanitizer occasionally. C. Hand hygiene. D. Wearing masks. The correct answer is C. Hand hygiene. Rationale. Proper hand hygiene is the most effective way to prevent the spread of infections in healthcare settings. When administering medication, what is the first right of medication administration a nurse should verify? A. Right patient. B. Right dose. C. Right route. D. Right time. The correct answer is A. Right patient. Rationale. Ensuring the right patient is the first step to prevent medication errors and ensure patient safety. Which of the following actions should a nurse take to prevent a needle stick injury? A. Recap needles after use. B. Dispose of needles in regular trash. C. Use a sharps container for disposal. D. Hand needles directly to another healthcare worker. The correct answer is C. Use a sharps container for disposal. Rationale. Disposing of needles in a sharps container reduces the risk of needle stick injuries. Which of the following is a priority action for a nurse to take when a patient begins to experience a seizure? A. Insert a tongue depressor. B. Restrain the patient. C. Protect the patient from injury. D. Give the patient something to drink. The correct answer is C. Protect the patient from injury. Rationale. During a seizure, the nurse's priority is to protect the patient from injury by ensuring a safe environment. What is the proper procedure for lifting a heavy object to prevent injury? A. Bend at the waist and lift. B. Use the legs and keep the back straight. C. Twist the body while lifting. D. Lift quickly and smoothly. The correct answer is B. Use the legs and keep the back straight. Rationale. Using the legs to lift and keeping the back straight helps prevent musculoskeletal injuries. Which of the following is the best way to ensure patient identification before administering medication? A. Ask the patient to state their name. B. Check the patient's wristband. C. Call the patient by name. D. Look at the patient's chart. The correct answer is B. Check the patient's wristband. Rationale. Checking the patient's wristband ensures proper patient identification and prevents medication errors. Which action is appropriate to prevent a patient from developing pressure ulcers? A. Reposition the patient every 2 hours. B. Increase the patient's fluid intake. C. Use a standard mattress. D. Keep the patient in one position. The correct answer is A. Reposition the patient every 2 hours. Rationale. Repositioning the patient every 2 hours helps prevent pressure ulcers by relieving pressure on vulnerable areas. What should a nurse do if they find a piece of equipment in the hospital that is malfunctioning? A. Continue using it. B. Try to fix it. C. Remove it from service and report it. D. Use it with caution. The correct answer is C. Remove it from service and report it. Rationale. Malfunctioning equipment should be removed from service and reported to prevent potential harm to patients and staff. What is the first action a nurse should take if they witness a colleague engaging in unsafe practice? A. Ignore it. B. Confront the colleague. C. Report it to a supervisor. D. Document it in the patient's chart. The correct answer is C. Report it to a supervisor. Rationale. Reporting unsafe practice to a supervisor ensures that appropriate actions are taken to maintain patient safety. How often should a nurse check on a patient who is in restraints? A. Every 2 hours. B. Every 4 hours. C. Every 30 minutes. D. Every shift. The correct answer is C. Every 30 minutes. Rationale. Patients in restraints should be checked every 30 minutes to assess their physical and emotional condition and ensure their safety. What is the correct procedure for disposing of a used forecatheter? A. Place it in a sharps container. B. Throw it in the regular trash. C. Flush it down the toilet. D. Disinfect it and reuse it. The correct answer is A. Place it in a sharps container. Rationale. Used forecatheters should be disposed of in a sharps container to prevent needle stick injuries and contamination. Which of the following is a key component of a fall prevention program in a healthcare setting? A. Keeping bed rails down. B. Encouraging patients to ambulate alone. C. Conducting regular fall risk assessments. D. Using dim lighting in patient rooms. The correct answer is C. Conducting regular fall risk assessments. Rationale. Regular fall risk assessments help identify patients at risk and implement appropriate interventions to prevent falls. When preparing to administer a blood transfusion, what is the most important action for the nurse to take? A. Warm the blood. B. Verify patient identity and blood compatibility. C. Administer the blood quickly. D. Mix the blood with medication. The correct answer is B. Verify patient identity and blood compatibility. Rationale. Verifying patient identity and blood compatibility is crucial to prevent transfusion reactions. Which of the following is an example of a nursing intervention to promote patient safety? A. Allowing patients to use their own electrical devices. B. Keeping patient information confidential. C. Ensuring clear walkways and uncluttered floors. D. Permitting family members to administer medications. The correct answer is C. Ensuring clear walkways and uncluttered floors. Rationale. Clear walkways and uncluttered floors prevent falls and promote a safe environment. What is the priority action for a nurse when a patient is found unresponsive and not breathing? A. Call for help. B. Start chest compressions. C. Give rescue breaths. D. check for a pulse. The correct answer is A. Call for help. Rationale: calling for help ensures additional support and resources are available to effectively manage the emergency. Which of the following actions is appropriate when a nurse administers a high-risk medication? A. Administering without double-checking. B. Relying on memory for dosage. C. Double-checking with another nurse. D. Skipping documentation. The correct answer is C. Double-checking with another nurse. Rationale: double-checking high-risk medications with another nurse helps prevent medication errors and ensures patient safety. What is the best way to prevent medication errors when administering medications to a patient? A. Administering all medications at once. B. Checking the patient's medication administration record (MAR). C. Following the 5 rights of medication administration. D. Relying on the patient's verbal confirmation. The correct answer is C. Following the 5 rights of medication administration. Rationale: adhering to the 5 rights, right patient, right medication, right dose, right route, right time, helps prevent medication errors. What should a nurse do if a patient is experiencing an adverse reaction to a medication? A. Continue the medication. B. Administer the antidote if available. C. Ignore the reaction. D. Increase the dose. The correct answer is B. Administer the antidote if available. Rationale: administering the antidote can counteract the adverse effects and stabilize the patient. Which of the following is the correct procedure for performing hand hygiene? A. Rinse hands with water only. B. Wash hands with soap and water for at least 20 seconds. C. Use hand sanitizer only when hands are visibly soiled. D. Dry hands with a reusable towel. The correct answer is B. Wash hands with soap and water for at least 20 seconds. Rationale: washing hands with soap and water for at least 20 seconds effectively removes pathogens and prevents infection. How can a nurse ensure safe use of oxygen therapy for a patient? A. Allowing smoking near oxygen. B. Securing oxygen tanks properly. C. Using any electrical equipment near oxygen. D. Ignoring oxygen level alarms. The correct answer is B. Securing oxygen tanks properly. Rationale: securing oxygen tanks properly prevents them from falling and causing injury or leaks. Which of the following actions helps maintain a safe environment for patients with dementia? A. Keeping lights off at night. B. Locking all doors. C. Using bed alarms and monitoring devices. D. Allowing unrestricted wandering. The correct answer is C. Using bed alarms and monitoring devices. Rationale: bed alarms and monitoring devices help prevent falls and ensure safety for patients with dementia. What should a nurse do first if they suspect a patient has been abused? A. Confront the suspected abuser. B. Document the suspicion in the patient's chart. C. Report the suspicion to the appropriate authorities. D. Ignore the suspicion unless there is proof. The correct answer is C. Report the suspicion to the appropriate authorities. Rationale: reporting to authorities ensures the patient is protected and appropriate investigations are conducted. Which of the following is a critical step in the safe use of patient restraints? A. Applying restraints without a physician's order. B. Using restraints as a first intervention. C. Regularly assessing the patient's need for restraints. D. Leaving the patient unattended in restraints. The correct answer is C. Regularly assessing the patient's need for restraints. Rationale: Regular assessment ensures restraints are used appropriately and discontinued as soon as possible to maintain patient safety.
Thank you very much.